I'm Bill Hoffman, Communications, Department of Laboratory Medicine and Pathology. I'm here with Dr. Brent Clark. Dr. Clark is Professor of Laboratory Medicine and Pathology, and he is Director of the Neuropathology Services at mHealth Fairview.
I grew up in Truman, Minnesota, which is a small town, south central Minnesota, and went to high school there. And then I went to college at McAllister in St. Paul. I had an interest in biological science and chemistry, I guess, in high school. And my guidance counselor, much to his credit, I guess, told me about a program that the Minnesota Heart Foundation was sponsoring for students in the summer. And so the summer after I graduated from high school, I got one of those awards, and I had the choice of either coming up here to the U or going to Rochester to the Mayo Clinic. I chose to go to Rochester because I had an uncle who lived close by and actually worked in Rochester. And so I ended up working with Dr. Jack Titus, who, was a very well-known cardiac pathologist. And he got me interested in pathology, and he continued to hire me back during the summers while I was in college. So I worked in the lab with him for 4 years. Interestingly, we didn't really work on heart pathology. He was also running the cytogenetics lab at the time. So I actually worked in cytogenetics at a time when it was quite primitive. It was basically just lining up chromosomes by size and shape. Banding hadn't even been invented yet at that point, so it was fairly primitive. But it piqued my interest in medicine, but also in pathology. And I entered the MD PhD program at Washington University, largely on the urging of Dr. Titus, who was kind of my mentor, who had been he was a graduate of Washington University, and the program was quite new at the time. The NIH had just started the MSTP grants, and there were not very many institutions who had them at that time. And he encouraged me to apply, and I assume he probably wrote me a very good letter as well. But I got into the program, and so the first 2 years of medical school were essentially like everyone else. We just did the 2 preclinical years, and then I went into the laboratory. And I initially worked with a neuropathologist named Dick Torak, but the project I was working on with him just didn't pan out. And so after almost 2 years, I switched projects and I started working with Dr. Boyd Hartman in the psychiatry department, who ended up moving here to Minnesota slightly before I did. But I worked on a regulation of blood-brain barrier, and so that was something that really kind of fit into my interests with the nervous system. But I did get my degree through the pathology department at the time, however, so my degree is in experimental pathology. Then I went back to medical school for 1 year. At that time, the program was set up so you only did the clinical year, the clinical clerkship year, and then you were ready to get out. And for me, that was fine because I was actually interested in going into pathology and not into a more clinically, patient-related subspecialty. So missing the 4th-year elective was not particularly a sad event for me. Well, I stayed in St. Louis for my postgraduate training. So I did residency in anatomic pathology and neuropathology. And then I stayed on faculty there for a while, and then I moved to Southern Illinois University for a while in Springfield, Illinois. And I'd always kind of looked to come back if I had a chance, and there was an opening when Dr. Mastery decided to leave the university back in the late 80s. And so I applied for the job, and so I've been here since the spring of 1990. Yes, so when I first came to the university, Dr. Juho Sung was the head of neuropathology, who had been here for many years, since the early 1960s. And he was beginning to transition toward retirement. And so after I was here for 2 years, he said that I should be the head of the division. And he kind of, spent another 2 or 3 years after I did that. One of the things that we had done historically as a division was consult with Hennepin County Medical Center and the Hennepin County Medical Examiner's Office, as well as with the Veterans Administration Hospital. And so I started to go down both to Hennepin and to the VA back in the early 90s. And I continued to do that for a number of years, although my relationship with the VA is they largely send the cases to me rather than me going down there. But I still consult with the ME's office in Minneapolis. Yeah, well, I've been teaching pretty much my whole career. I came here like I said, in 1990. I started teaching in the second year pathology course at that time. And I've been co-director of a block of that course for a number of years now. They're called HHD 5 now, but it's the block that's neurology, psychiatry, and ophthalmology and ENT. So Dr. Kaz Nelson and I have been co-directing that course for a number of years. I also have an elective clerkship for third and fourth year students, mostly fourth year now, I guess, where they come to work with us generally for a month and pretty much take a role on the service very much like a resident would. And that's actually been quite interesting because we probably get 6 to 8 students a year, most of whom are interested either in going into pathology or into clinical neurosciences, neurology or neurosurgery, occasionally psychiatry. Yeah, so before I came here, a lot of the work that I did was related to myelin disease. And when I got here, I continued to do a little bit of work with Gary Birnbaum, who was a neurologist in the neurology department here, who worked on models of MS. But shortly after coming here, Harry Orr came to me, and he had these transgenic mice that looked rather unusual. He had been trying to generate cell lines of Purkinje cells, so they were trying to make tumors of Purkinje cells that they could explant and use to study sort of a more immortalized Purkinje cell line. And as many experiments go, the initial goal was not met, but it became actually a much more interesting observation that by putting the transgene into these Purkinje cells, rather than immortalizing them, it ended up killing them. So we ended up with an animal model of ataxia. And Harry's lab at the same time was working on identifying the gene for spinocerebellar ataxia type 1 in collaboration with a group in Baylor run by Huda Zogby. And so using that same strategy, once they found the gene, they put the gene into mice. There was a postdoc named Eric Burright who did a lot of that work. And I got very involved in trying to characterize these mice. And so Harry and I have been collaborating really for almost 30 years. And so that's been an extremely fruitful collaboration. The myotonic dystrophy kind of stemmed in some sense from the ataxia work. Several of the people that were on that project, John Day and Laura Random, who actually had been a postdoc in Harry's lab at the time that the SCA1 gene was discovered, they were working on the CNS effects of myotonic dystrophy. Myotonic dystrophy typically is a disease we think of as a disease of muscle, but many patients with the disease develop cognitive abnormalities as they begin to age, and so they were quite interested in trying to figure out what was going on with that, and they enlisted my help. So we had a program project that ran for about 10 years studying that in collaboration with another laboratory down in Florida by Maury Swanson. The concept of being sort of awed by the human brain, I think, is something that pretty much everybody who works with it feels. Every time I examine a brain, it's amazing to me, that I've examined thousands of them, but each one seems very interesting and new. And it's amazing to think about how much damage the brain can sometimes undergo and people still be relatively functioning. and sometimes how little damage there can be and how dysfunctional they can be. It's a never-ending fascination. Every case just has something new to offer, it seems. Well, I think it's very much like other anatomic pathology disciplines. I mean, I think where precision medicine is hit first is in the area of neoplasia. I think that molecular characterization of tumors is beginning to replace some of our classical grading systems, and probably is much more useful in terms of prognosis. And certainly, I think, even though in brain tumors it's been somewhat discouraging, I think that finding targetable mutations that can be used as therapeutic targets is a goal, although I think it perhaps not as has been as fruitful as it has in some other areas of the body. But I think that that's really going to be one of the major things that people that are training in neuropathology now are going to have some background in molecular diagnostics, because this is becoming a major component of our diagnoses now. Almost every glial tumor that we do requires some sort of additional molecular studies in order to really fully characterize it and to optimize what meager therapies we do have for patients with these tumors. And it's had some effect. The overall survival for even high-grade glial tumors has improved, and some of that has been related to particular drugs. And we know that there are certain molecular profiles that will indicate that those drugs will be much more effective in certain patient populations than in others, and you may not want to push those drugs in people where the outcome may not be particularly favorable, and you're just getting a lot of side effects without much benefit. Certain things in neurodegenerative disease where there are things that are quite tedious, such as counting various microscopic abnormalities and those sorts of things have certainly been helpful, and certainly in terms of sign out and whatnot. So I don't think computers have had the same impact in neuropath as they have in some other areas, and largely because it's a pretty visual discipline, and I think things like artificial intelligence are starting to make inroads in anatomic pathology, but I feel that much of what we do requires a sort of higher level of pattern recognition that may not be something that's going to be easily translatable into AI, at least in the near future.